Hi everyone, welcome to Webinar Wednesday. I'm your host Kelly Cawthorn and I'm so glad you could join us today. October is Breast Cancer Awareness Month, and what better time than now to discuss the second most common cancer among women in the U.S. Did you know about 1 in 8 women will be diagnosed with breast cancer during their lifespan? Chances are you probably know of someone who has been diagnosed with breast cancer, whether it's your mother, sister, friend, coworker, or another family member. Today's speaker was handpicked by myself because of her expertise and strong advocacy for women's health. So let's learn a little bit about today's speaker. Dr. Meena Eswaran is board certified by the American Board of Family Medicine. Her clinical interests include preventive health, women's health, and geriatric care. She joined Kelsey-Seybold in January 1995. When she's not caring for patients, Dr. Eswaran enjoys traveling and studying the history and culture of different countries. Now, as you know, it's poll time, so we want to hear from you. Our poll question for today is, which of the following increases your risk for breast cancer? So I'm going to go ahead and launch the poll. Is it race and ethnicity, being overweight, smoking, gender, or all of the above? Take a few seconds to answer the poll right now. Got some great answers coming in. Give you just a few more seconds. All right. At the end of the webinar, we will reveal the results and take any questions you might have about breast cancer. Now, I will close the poll and pass it on to Dr. Eswaran.
Okay. Hello, everyone. October happens to be Breast Cancer Awareness Month, so it seems only appropriate to talk about breast cancer for our webinar today. My name is Meena Eswaran. I'm a family practitioner with the Kelsey-Seybold Clinic, and as a family practitioner, I often see patients presenting to our clinic with various complaints related to the breast. And they always have this underlying fear that they may have breast cancer. So the purpose of the webinar today is to discuss some of these complaints, to try and talk about some of the signs and symptoms of breast cancer, the necessary screening and diagnostic tests available, and discuss some of the risk factors for breast cancer and see how we can try to reduce some of these risks. Okay. So to begin with, just a very simple anatomy of the breast. As you know, the breast is a very important part of our female reproductive system, and the main purpose of the breast is to make milk. So with that in mind, we have the little glands here where the milk is produced. The milk then travels through these tubes or ducts to the nipple area where then the milk is then expressed. So surrounding all this, we have fibrous tissue and fat cells which support the breast structures and also maintain the shape of the breast. There are many differences in the size, the shape, and composition of breasts among different women. And here are some mammographic findings to demonstrate some of these changes. So for instance, in the very first one here, this is probably a breast of an older woman. You see there are very few glandular cells, and most of this is just fat. In the second picture here, we see some of the fibrous and glandular elements as well as some fat. Here there's more of the fibrous glandular elements, and here this is what we would call dense breasts. As we will talk a little bit later, dense breasts actually poses an increased risk for breast cancer. And as you can imagine, reading a mammogram like this would be quite difficult. There could be something underlying all this that may not be apparent to the observer. So what are some of the complaints that patients have when they come into our offices? Okay, the most common complaint that patients present with is breast pain. And your doctor may ask you if this pain is cyclical or non-cyclical. What that means with cyclical pain, it usually occurs in a woman who is still having her periods. They often experience pain about a week before their periods, and then it improves once your period starts. And this is a very normal process, and it's related to hormonal changes that occur in the breast. You can have non-cyclical pain from various causes. There are some dietary factors like excess caffeine in the diet, smoking, taking medications like hormone replacements. Also in some women who have larger breasts, sometimes with the stretching of the ligaments, you may experience breast pain, neck pain, upper back pain, and so on. The second complaint are breast lumps. These are often discovered at home by women themselves through their self-breast exams. And again, there are a variety of causes of breast lumps. The common ones are cysts that can form. They're just fluid-filled collections, or it could be a fibrous tumor. And oftentimes this causes a lot of concern for women. Then you have trauma to the breast that may occur from falls or from motor vehicle accidents and so on. You may have bruising in the breast. You can have infections in the breast. Often bacteria may enter the breast tissue through cracked skin, cracked nipple, very common during nursing and so on, and it may need some antibiotics for treatment. Then there is the complaint of a nipple discharge, and we'll go on to this a little more in the next slide, but the doctor may ask you if this is from one breast or both breasts, and the type of discharge. Oftentimes if it's a milky discharge, it's not a cause for great concern, but if it is a clear discharge or blood in the discharge, and especially if the discharge occurs spontaneously, which means that you're not attempting to press on any of the area of the breast to cause it, it just happens spontaneously, then that's a cause for more concern. And of course there's breast cancer, which we'll talk about a little later. So when we talk about some of the warning signs of breast cancer, some of the things to watch out for are if you're feeling a lump, a hard knot, or a thickening in the breast or underarm. If you notice that the size of the breast or the shape of the breast has been altered or has changed in some way, if you notice a dimpling of the skin, and you may notice this when you raise your arms up in the air, or you might also notice that the nipple gets pulled inwards. It's called an inverted nipple, and if these are new changes that have occurred, then that is something you want to bring up to your doctor at the office. If there's persistent swelling, redness, or warmth in the breast, if there's pain in one spot of the breast that doesn't vary with your cycle. We talked about nipple discharge already. And then if you have like an itchy, sore, or scaling rash on the nipple that's just not getting better with treatment, then again, this might be a cause for concern. But the important point to remember is that none of these are definitely cancer. It's just something that you might want to bring up with your doctor to discuss, and maybe want to do some further testing to see if that's the case or not. So why is breast cancer so important? Worldwide, breast cancer accounts for more than 1 million cases per year. In the United States, breast cancer is the second most common cancer among women, and 1 in 8 women will be diagnosed with breast cancer during their lifespan, and this amounts to about 12% of women. And this number has been fairly steady for the past 5 years. In 2014, it's estimated that among women in the U.S., there will be about 200,000 new cases of breast cancer and almost 40,000 breast cancer-related deaths. So this is a very important problem, and one that we all take seriously. So what are some of the risk factors for breast cancer? What are some of the things that we can do? Well, there are some things that we know are risk factors for breast cancer, but we really don't have any control over these risk factors. Obviously, being the gender, being female, puts you at increased risk of breast cancer. But it's really important to remember that men can also develop breast cancer, although it is 100 times more common in women. And we will talk about male breast cancer a little later in the talk. Getting older is another risk factor, again, something we really can't do anything about. If you look at this slide here, it shows that the new cases of breast cancer increases as we get older, peaking at around your late 60s, 70s is when we see most of the breast cancer. Race or ethnicity is another factor. So we look at this slide here, we see that the highest rates of breast cancer are seen in Caucasian women, and African women are second. The lowest rates are seen among Alaskan Natives and American Indian population. Why this is so? There may be many factors. There may be a genetic basis for this. There may be environmental factors, dietary factors, and so on. Then we talk about family history as being an important risk factor, especially if the breast cancers occur before the age of 50. And it's thought that having first-degree relatives like your mom, your sister, your daughter with breast cancer approximately doubles your risk of breast cancer. And having more than 2 increases it even more. A personal history of breast cancer. Obviously, if you've had breast cancer in one breast, your chance of it developing in the second breast is definitely increased. Menstrual history is important. So starting your periods early, under the age of 12, or going into menopause late, greater than age of 55, are thought to be risk factors. And it's thought that this may be related to the fact that your body is exposed to the hormones for a longer period of time. And if you've had any precancerous breast lesions diagnosed, if you'd had a biopsy and the biopsy suggested that you didn't have cancer, but there was some changes that indicated they were precancers, obviously your risk for breast cancer increases. Some of these factors we can control to some extent. Being overweight, lack of exercise, smoking, excessive alcohol use are all considered risk factors. The other risk factors, we'll talk a little bit about that later. Other risk factors are if you've had radiation exposure, for instance, radiation treatment for conditions like lymphoma before the age of 30, or gene mutations like the BRCA1 and BRCA2, which we will talk a little bit more in detail. And then we talked about the dense breasts earlier. Some other, that's fine. Some other risk factors that people talk about also are breastfeeding and also late pregnancies. If you have a pregnancy after the age of 30, it's thought to increase your risk for breast cancer, or if you've never breastfed, that's also considered to be a risk factor. So some of the breast cancer myths that we talk about, people worry that using deodorants, lotions, underwire bras, any injuries to the breasts may all lead to breast cancer. Well, none of the studies have really shown that this is the case, and breast cancer is not contagious. Okay. So as far as breast cancer prevention, what are some of the things that we can do to prevent breast cancer? So healthy diet, limiting your alcohol intake, exercising, maintaining a normal weight, avoiding taking hormones unless necessary, have children before the age of 35. Well, it's not always under our control, but it's certainly something to consider if you have a choice. Or breastfeeding is protective as far as breast cancer prevention. What are some of the other things that we can do to prevent breast cancer? Avoiding unnecessary x-rays. Definitely go and talk to your doctor if you have a family history of breast cancer to discuss your individual risk. There are some medications that are available for patients who do have very strong family histories of breast cancer and that are considered to lower your risk. And then we also talk about preventive surgery, and this has been in the media a lot recently, prophylactic mastectomies and oophorectomies. And they certainly, for instance, a prophylactic mastectomy, it certainly can be a useful aid or useful treatment for certain patients who are at high risk of breast cancer. But you have to consider the risks associated with the procedure. Of course, with any surgery, there is the risk of bleeding, infection, scar formation. There's also loss of sensation in the breast area, and of course a lot of anxiety and depression can follow, and this is certainly something that needs to be taken into account. And although the prophylactic mastectomies do reduce the risk of developing breast cancer by 90% or so, there's still a small percent, it's not 100%, there's still a small chance that breast cancer can still develop. And mainly this is because you have breast tissue that may line the chest wall, or it may be under the arm, and a surgeon cannot go in and remove every single breast cell in the body. So there's always a very small risk that you might still get breast cancer. So what are some of the things that we recommend? For instance, a self-breast exam is important. And this is something that you and your doctor may have discussed during your physical exams, or the doctor might have given you some information to take home on how to do a proper breast exam. And this is also available on the web. But next time you go into your doctor, if you don't have one of this, you may ask them for this information. It's recommended that you do breast exams. Preferably about a week after your period starts. If you're postmenopausal, just the same time each month would be a good idea. And it's important to just take your time and do, take your time and examine your breast probably, so you're comfortable knowing what's normal for you. And I'm not going to go into this in detail, but if anybody needs this information, we can definitely forward it to them. The clinical breast exam involves going to see your doctor. It's every 1 to 3 years if you're between the ages of 18 to 39, and regularly after the age of 40. Apart from the actual exam, it also includes taking a personal health history, discussing your family history, and looking at your risk factors for breast cancer. And you can, at this point, you can also talk to your physician if you're concerned that you or detected any signs or symptoms of breast cancer yourself. So what are some of the screening tests that are available? So there's the mammogram, and that can be screening or diagnostic. The screening mammogram is recommended for women who really have no symptoms or signs of breast cancer. But it starts at the age of 40 or 50. But earlier may be considered for somebody who's really at high risk, as somebody who has a BRCA gene carrier, a very strong family history. Mammograms can find small cancers before they can be felt, but it's important to remember that they don't find all cancers. But it's still the best tool we have right now to find cancers early. If there's something found on mammogram, they may ask you to come back in and get a diagnostic mammogram, during which they may focus on a specific area of abnormality, do a spot magnification view or something like that. Now, it's also important, if you've had your mammograms done at another institution, it's important to ask for a copy of the mammogram. You can either sign a form at your doctor's office and have them forward your previous mammograms to you, because it helps the radiologist see if there are any changes, if there are some differences in your mammogram, if this is something that was present before, if it is, in which case we may not need to do a lot of unnecessary testing if it's been pretty stable, or if there is a change, it might alert the radiologist to recommend some further test. There are some differences in opinion as to how often we should be doing a mammogram. The American Medical Association, the American Cancer Society, they all recommend starting mammograms annually at the age of 40. The AFP and the United States Preventive Services Task Force recommend having mammograms every 1 to 2 years starting at the age of 50. But in a woman who's considered high risk, we have to look at that individually and consider getting mammograms earlier. Yeah, we talked about all this. Bringing your old studies for comparison is really important here. So these are some of the changes that the radiologists look for. These are some calcifications, and it's a certain pattern or the number of calcifications may alert the radiologist that this is maybe an area that needs to be biopsied. And here's another suspicious mammogram. This would be an area that the radiologist might recommend we go ahead and biopsy. Ultrasounds are used to look at an abnormality seen on the mammogram in a little more detail. It's useful when you have a lump and they're trying to determine whether it's a fluid-filled lump or a solid lump. And it's also used for when you're trying to drain a cyst or do a biopsy. It helps us to identify exactly where that lesion is. Breast MRIs are also another test usually it's recommended for patients with maybe for further evaluation if they have had recently diagnosed breast cancer, but it may also be considered in women who are thought to be sufficiently high risk as a screening method. We're going to talk about the BRCA testing. And as far as what exactly is the BRCA testing and why is it so important? So the BRCA, they're genes that are present inside the cell, and they produce proteins which help repair damage to the genetic material inside the cell. So when you have a BRCA mutation or when you have an abnormality in the BRCA gene, these proteins that do the repairs are not able to do their job. If the repair does not occur in a cell, then that cell is at risk of developing breast cancer. So that's essentially what we're measuring when we check for the BRCA mutations. And together, only about 5 to 10% of breast cancers have a genetic basis, but with BRCA1 and BRCA2 mutations, your risk for breast cancer is significantly increased. We talked earlier about the 12% risk as far as a lifetime risk of developing breast cancer, but when you have a BRCA1, the risk may be as high as 55%, and a BRCA2 may be as high as 45%. And breast cancers associated with the BRCA genes often tend to occur in younger populations. So who should be tested for the BRCA gene? So for instance, if you have a family history of breast or ovarian cancer in a relative who has a known BRCA mutation, that's something that you would consider. All women should be tested if one of the following risk factors is present. If you have 2 first-degree relatives with breast cancer, one of whom was diagnosed before the age of 50, at least 3 first or second-degree relatives with breast cancer, regardless of age at diagnosis, and so on. And this information is available on the web, and we can also forward it to you if you are interested. But I'm just going to put that up here so you can read it. So what happens if you have a diagnosis of breast cancer? Then it depends on the stage of the cancer, obviously, the size of the tumor, whether it's in the breast or it has spread to other parts of the body. They also check for hormone receptors on tumors because there are certain medications that can be given specifically for these types of tumors. There's also genetic testing that's done on cells and specific medications available that target these particular follicular cells. How fast the tumor is growing is important. The age, general health is important. And as far as treatment, of course, the first stage is staging the tumor, determining what kind of tumor you have, and then the options are the lumpectomy, mastectomy, removal of lymph nodes, reconstruction of the breast, radiation therapy, chemotherapy, hormonal and therapy that we talked about. And it's also important, to remember the patient. It's very important that when you get a diagnosis of breast cancer, it's a very difficult diagnosis, and it's important to make sure that we tell patients about resources that are available, support groups that are available, and making sure that we address the psychological needs of the patient. I wanted finally to talk also about male breast cancer. It's a subject that's often not talked about. Only about 1% of breast cancer cases occur in occur in men. But the important thing to remember is that oftentimes men present with very late in the stage of breast disease because they don't believe that they can get breast cancer, and they tend to ignore the symptoms and signs of breast cancer. But as far as symptoms, it can show up as a lump under or near the nipple, or they may have a misshapen breast or a nipple discharge. And it's important to recognize that men can get breast cancer also. And breast cancer in men can occur at any age, but it's most common at 60 to 70 years. Lumps can usually be felt. There's some of the risk factors are any exposure to radiation that they may have had, or any condition where estrogen levels may be high in men, and you see that sometimes in cirrhosis or some genetic conditions like Klinefelter's, where you have increased estrogen in the body. And also family history or the BRCA mutations, these are all factors in men also. So what can we do as an individual? Definitely try to minimize your risk factors whenever possible. Be aware of your breast cancer risk and check your breasts regularly at home. Come into the office regularly and have your breasts examined by a physician. Get your regular mammograms. And then as a community, participate in events like the Relay for Life and Tour de Pink and so on. Volunteer with the American Cancer Society or other organizations. Donate to research. Talk about breast health with your friends and family members. Especially encourage your mom, your sisters, your friends, your daughters to go in and get their breast exams regularly, do self-breast exams at home, and there are also many other opportunities to help online. So in conclusion, it's important to know your risk of breast cancer and what you can do to decrease it. Get screened. Do not ignore your breast symptoms. Do not be afraid to talk to your doctor, because early detection is the key, and cancers caught early can be successfully treated. Thank you.
All right, that was a great presentation. We definitely learned a lot during this short 30 minutes, but now we'll take your questions. So go ahead and type a few questions if you have any concerning breast cancer. I have one myself that I can go ahead and kick off. Seeing as though I am only 27 years old, will be 28 on Friday, but breast cancer is something that I feel like I shouldn't worry about being in my 20s. So what advice do you have for women that are in their 20s, and should we be knowledgeable about breast cancer being this young?
So as far as young women, I think it is never too early to know your family history and to know what your risk for breast cancer is as far as your family history. So it's important to be aware of your, if your mom, your grandmother, your sisters, if there's any diagnosis of breast cancer in the family, it's important to be aware of that. And in addition to that, I think self-breast exams can start at as early as you can, so it's important to learn how to do a proper self-breast exam and be aware of what your breast normally feels like. So if you notice any changes in the breast, you'd be able to bring it up to your doctor and have them determine if this is something that needs to be looked into further.
Great. So we have another question, or actually the person that's asking this question is 72 years old on the other spectrum, and so she wants to know, should she be receiving more mammograms than you recommended in the presentation?
Okay, well that's a good question. There's not a consensus as far as that is concerned. The United States Preventive Staff Forces say that it's not necessary to do mammograms after 74, but none of the other organizations have come up with that. I think it depends very much on your risk, your family history, your how they determine your breast cancer risk and so on. But there's no consensus on that. But generally, like I said, after 74 is the only recommendation that I was able to find in that regard.
Since you've been at Kelsey-Seybold Clinic for quite some time now, can you kind of walk us through how do you schedule a mammogram? Can you do it directly? Do you need to have a well woman exam first? How does that work?
It's always better to do a well woman exam first because during the well woman exam, the doctor will examine the breast, and if there are any changes noted on exam, then they might address something more specific than just a screening mammogram. They might recommend a diagnostic mammogram if they're feeling a lump, or they might and an ultrasound and so on. And it's also a good idea to know your breast cancer risk. So this is something that would be discussed at your well woman exam, so that so I think these things are important, and we have we have an appointment system here at Kelsey where you can have a mammogram hold. So when you make your appointment for your physical or well woman, you can also ask for your mammogram to be scheduled that same day. So oftentimes you see your doctor, get your physical exam, and then you can go and get your mammogram that same day. So that works out well for a lot of patients, not having to take time off on a separate day and so on.
Great answer. All right. Oh, we have questions flying in now. Okay. What other resources does Kelsey-Seybold have for breast cancer patients? I can take that question. Yeah. We have quite a few resources for our breast cancer patients. We have our breast diagnostic center with absolutely great oncologists there who are there to care for our patients. We also have our breast cancer support group who meet once a month, who also really rally behind our annual breast cancer awareness walk that we do with Susan G. Komen. And it's a great organization, and actually we're one of the most well-known organizations here in Houston, Texas. So there's also additional information on our website, kelseyseybold.com, for you to find out more information about Kelsey-Seybold. We have a few specific questions, so I'm just going to read through this particular question. I am a 55-year-old. My breasts have become much flabbier in the last 3 years. Apparently it has lost a lot of its structure. And in the last 6 months, it feels like they have literally migrated to under her arms with occasional pains from in the outer front area. No reason to have pain that I can think of, but is this normal age-related changes, or is this something that we should definitely, or she should definitely go get checked out?
Well, there are changes that occur to the breast as we get older. For instance, I had mentioned earlier in my talk that a lot of the breast tissue gets replaced with fat. So some changes do occur as you get older. However, if there is a real concern that the breasts have become misshapen, especially if it's on one side, and then it's a good idea to go in and see your doctor and get a breast exam and get your mammograms done.
Let's see here. Oh, here's an interesting question. What if you don't know your grandmother's history in a case of adoption? Is it just your mother or your sister history that is critical?
The grandmother would be considered the second-degree relative, but it's important to know your first-degree relatives would be your mom, your sister, your daughter. So that would help. It certainly is good to know an extended family history because it helps to quantify your risk. But even with the history that you have, it's still possible to get somewhat of an assessment of your risk and take the appropriate steps. And you should still get your exams and your screening mammograms as we had discussed earlier.
Okay. We'll take a couple more questions since we're running out of time. Here's another patient. I had a bilateral mastectomy 3 years ago. My examinations are presently being done by the surgeon for the next 2 years. What type of examinations will she have to have after this time period?
Well, I think that is something you should discuss with your surgeon. If you've had the bilateral mastectomy, they usually follow you. Either your surgeon or your oncologist may follow you for a few years, and then you can get your regular exams with your primary care doctor. And it's important to discuss that specific question with your surgeon or your oncologist as to what the recommendation is long term. Generally, so it's important to discuss that. And again, it depends on the circumstances and the type of tumor that you had and so on. But it's an important question to discuss with your surgeon.
All right. Well, that concludes our webinar for today. I want to thank everybody for joining us. And before we leave, I want to share the results of our poll. It looks like 85% said all of the above, that gender, smoking, being overweight, and your race and ethnicity are all risk factors, and you are correct. Dr. Eswaran mentioned this earlier, the difference between controllable factors and uncontrollable factors, so keep those in mind when you are thinking about breast health. Thank you so much, Dr. Eswaran, for teaching us the basics of breast cancer and why it's important for us to take the necessary steps to educate ourselves about the prevalence and impact of the disease. But before we sign off, first, we have to take care of a few housekeeping items. We are very excited to announce our campaign, Healing Happens Here, Our Story, Our Cancer Journey, which highlights these 4 women who are willing to share their personal breast cancer journeys through a year-long video blog. So visit Kelsey-Seybold.com for more information. Also, if you happen to be driving past one of our 8 locations, main campus, Pearland Clinic, Pasadena Clinic, Fort Bend, Tanglewood, Stinker Ranch, the Vintage Clinic, or our administrative building here in Pearland, snap a selfie or a photo in front of our pink lights that are lit at night to be posted on our breast cancer album on our Facebook page. Send your photos to me, kelly.cothran@kelsey-seybold.com. That concludes our webinar for today. Please join us next month when Dr. Koo presents The Flu versus You. We will discuss the different ways to protect yourself during the flu season. I think that covers it. Thanks again for tuning in, and we will chat next month.